A year ago, Erica Chaco suffered from a persistent headache, fever, and worsening muscle and bone pain. Thinking something was seriously wrong with her, she sought medical help. Expecting to be referred to a specialist, she was instead put on a waiting list.
I had a fever of 40 to 41 degrees every day. I was so weak I could barely stand. I lost my job, and within a few weeks, I lost everything I had worked so hard to achieve.
She was admitted briefly to a Budapest hospital, but was soon discharged when her fever subsided.
They pumped me full of steroids, which only made my condition worse. My kidneys stopped functioning. It's just been a horrible year for me. They said they couldn't do anything more for me and kicked me out.
Erica's story isn't uncommon. In Hungary, healthcare experts say the country faces a crisis due to the departure of many doctors and nurses for better opportunities in Western Europe. Over the past decade, about 8,500 doctors and nurses have left Hungary. This has led to understaffed hospitals and longer patient waiting times. There are nearly 40,000 patients on the waiting list for surgical and medical procedures here in Hungary, according to the National Health Insurance Fund. Some people have to wait 6 months before they get the care they need, meaning that Hungary has some of the longest waiting times in Europe. Dr. Adriana Sos, who leads Hungary's Healthcare Association, blames the government for the country's struggling health system.
One of Hungary's major issues compared to the EU is the low spending on healthcare as a percentage of the national income. This affects the quality of healthcare provided.
Hungary currently spends the least in the EU for healthcare, with the government allocating just over 4% of the GDP to public health. However, in January, salaries for doctors and nurses were increased by 11% in an attempt to retain medical professionals. Now, the average monthly salary for a general practitioner stands at about $6,200. Despite this, many doctors say they still feel overwhelmed by their workload, with more patients and fewer resources.
The EU should set minimum wages for healthcare, just as it has done with other industries. This means each country should ensure their healthcare wages meet this minimum standard. Similarly, the EU could require member states to maintain a certain level of healthcare standards. This would ensure a consistent level of care across the EU.
It took nearly a year for Erica to be diagnosed with myelofibrosis, a rare bone cancer that stops the body from making enough red blood cells. Now she gets 2 blood transfusions every month. Despite her condition, she treasures each day, knowing that with proper treatment, people with this disease typically live about 6 years. Pablo Gutierrez, CGTN, Budapest.